Welcome to Staying Safe While Working in the Community, Mini Module 5, and Module 5 covers Client Risk Assessment. And as you know, we've done this whole program consists of 11 mini modules, and the next subject that we're going to be covering is the client risk assessment, and then the next two modules will cover the environmental risk assessment and community assessment. So when we move on to client risk assessment, this is kind of the list of activities or things that we need to consider when we're looking at the client. So there's the diminishing cognitive ability, challenging behaviors, refusal of service, history of aggression or reactive behaviors, verbal abuse, communications barriers, decreased physical mobility, tobacco, alcohol, medication, sexually inappropriate behavior, clients that have dogs or cats in the residence, the presence of or suspected presence of potential dangerous weapons, and evidence of criminal activity. So when we look at one of the first ones, which is the diminishing cognitive abilities, so this is with our clients as we have an aging population, or if you have someone that's intellectually delayed or has other brain injuries or other things, the cognitive ability of the person that you're providing care could be declining. And sometimes this can be affected by medication or other things. So with this decline or the loss of mental function and memory, areas to be concerned about include attention, thinking, ability to concentrate, problem solving, memory, disorientation, apathetic towards life or surrounding, and diminishing language skills. So sometimes when the client comes into your service, they have some signs of a diminishing cognitive ability. But if those situations change through the care, then you need to make sure you communicate that to your supervisor and ensure others are aware of the situation, especially if it's something that's new to the client, or if you are under the impression the client has a certain cognitive ability on intake, and once you get there and start to spend some time with the client, you find that is quite different. That needs to be understood by everybody who's providing service to that individual. Challenging behaviors or complex behaviors can include aggression, recklessness, anxiousness, defensive behaviors, hearing or seeing things that don't exist, impulsiveness, can be hoarding or rummaging, inappropriate sexual behavior, resistance to care, suspicious or accusing others, and it can be vocal or other disturbing behaviors, wandering. And once again, if these behaviors become hazardous to themselves or the worker that's providing service, then that needs to be reported to the supervisor and others that can help reduce the risk of these challenging behaviors. And the thing to remember with challenging behaviors is it is an unmet need, or there's something that's triggering that. And so we need to try to work with the client to find out what it is that's resulting in this behavior or this reactive behavior. And usually once we work through those issues and we find this, many times many of these things diminish, and sometimes it can be that the client in dementia goes through certain phases and stages that some of these things are more heightened in some points as the disease progresses, and then they will dissipate on their own. We have situations where we look at refusal of service. that's vital to the health and and safety of the person. So a lot of times home care or other services coming into the home aren't necessarily initiated by the client themselves. Many times it's the family members that have been diligently providing care to their loved ones, and circumstances change or things change that they're no longer able to do that. And they'll call and ask for help and get services. But a lot of times the client doesn't fully understand or fully agree that or accept that they're ready to have those services. And so they may refuse to allow you to come and provide services. So you have to be prepared for that. And if this is, on top of this, if there's a history of aggression or reactive behaviors from other interactions, then it's good to know that prior to going to that situation. So when that happens, or if you come into that situation, you need to contact your supervisor immediately, make them aware of this situation, and it may require some referral to some other mental health services. Verbal abuse is something that we're faced with probably far too often. So the use of threatening words, remarks, or language that's intimidating, humiliating, harassing, that may lead to conflict between the client and the worker. And it's really about, documenting and reporting to the supervisor when those things happen, and use your verbal de-escalation techniques when you're faced with those situations, and advise the client or the family that they're responsible to provide a safe environment for the worker, and that type of language and remarks are not acceptable. And if it's that severe and the worker's feeling quite threatened, it may result in the withdrawal of service until that type of behavior is rectified. Many times as our client's health declines, there can be communication barriers. So the reduction in the ability to communicate due to language barriers, cultural differences, cognitive function, physical impairments. So misunderstanding due to communication can lead to increased risk of aggression and response and conflict between the care provider and the client. So when there's communication issues, the client may not be able to fully communicate what it is that they want, or they may not be able to fully understand what you're trying to communicate to them. So many times, this results in a lot of frustration on both parts, and trying to work towards people keeping that in mind. And sometimes if English isn't their native tongue or their first language, as they go through various challenges with dementia, they may not fully recover or understand the words that seem so simple in the English language, and they may be only communicating in their native tongue. So those are things that need to be considered. When there's these behaviors with communication, documenting and reporting them directly to the supervisor to ensure they're aware of the situation, and identify the source of the communication barrier, and also make sure that you give them time to formulate their response. Make sure you're using active listening skills, and make sure that you're not doing anything to trigger any negative response for them by, remaining calm, not raising your voice, not getting in their personal space. All of those things help to keep that situation from escalating. When we're referring to client risk factors, the decreased physical mobility is another reason that many times home care workers are brought in to help the family. So when we think about the client, they're having that decrease in the physical mobility. The client may require assistance with walking, ambulation, transfer, repositioning, and patient handling is very physical in the healthcare sector. And one thing that we need to keep in mind is, you know, depending on the time of day, medications, what's happened, who may have been there, and what activities may be happening before you get there, that physical mobility can change. So it's really important that there's a client assessment done every time before you transfer, reposition, or assist a client, because although when the original assessment was done, they may require just minimal assistance, but depending on other things and changes, that they may require more assistance. And as a client's physical ability declines, it may require an assessment to be done to maybe now having to bring a mechanical lift into the home. And if that's a persistent, ongoing decrease of mobility. Again, another thing to consider when you're in the home is the use of tobacco, alcohol, medication, and other substance abuse issues. So the use, you know, most clients are taking some medications, but we have to think about what the impact of that is, if it may lead to violence. Tobacco is smoking in the home, and most organizations indicate that there's not supposed to be any smoking 1 hour prior to a care provider coming into the home, but that's sometimes difficult to monitor and follow. And there can be medication interactions, and then of course alcohol, if alcohol is being consumed in conjunction with other medications or other substance abuse things happening in the home, either by the client or the family members of the client. So all of those types of activities need to be reported to the supervisor, and make sure that others are made aware of the situation, and make sure the client and the family are advised of their responsibility to provide that safe environment to the worker. And if it's deemed unsafe, then they'll have to consider the type of service provided. So sexually inappropriate behavior, and this behavior is associated with, you know, usually with the loss of a socially, you know, socially appropriate behavior and impulse control. So that can be verbal requests for sex, masturbation, undressing, lewd comments. And I think the thing to remember is, depending on where that person is and the progression of their disease, a lot of our healthcare workers, it starts out very innocently, so they'll hug their clients when they get there or something like that, and it's challenging because they do really care, but we have to remember that that may not be the best, well, it's not the best thing to do, because it's best to keep that professional environment. And then as they're struggling with their disease, it may lead to them then thinking that means something that wasn't intended. Then we look at clients with pets, cats and dogs in particular. The presence of animals can be potentially harmful to community care workers, and clients should be aware of the pet policy. And they need to be aware of the pet policy even if they don't own a pet, because sometimes family members can come and visit and bring pets with them. They still fall under the policy of the organization that no pets are to be there. Now, I know there are some private agencies that work with clients for long periods of time and do allow pets, but you need to be understand the risk that's being undertaken. But most home care, home support work that's being provided by the province and funded by the province doesn't allow for pets to be present while the caregiver is providing care. So we have to think also about the presence or the suspicion present of potential dangerous weapons. So that's knives, hunting weapons, guns, bows, ceremonial weapons, and other things that could be used as a weapon. So if there's any weapons that are present or you suspect there's the potential for those weapons to be there, then you need to exit the dwelling immediately, contact your supervisor, and if necessary, consult police. So ensure that firearms are stored and locked in cupboards, and ammunition storage is to be stored separately, and you need to inform the client or the family that the service will be withheld until the firearms are stored, unloaded, and locked appropriately. Evidence of criminal activity or gang activity. Clients may live in a community that's either in or a close proximity to a gang-related activity or illicit drug houses. Anyone within the dwelling on house arrest or restraining orders. So all of those things that if there's serious risk of those criminal activities, you need to exit the dwelling immediately, contact the supervisor, or contact police if necessary. And this is always challenging because many times we are working in communities that have quote-unquote a reputation, but it doesn't necessarily mean it's related to that home. So you need to take the appropriate risk in entering those communities, be aware of what's going on, but that doesn't mean that care can't be provided to individuals that are living in that community. So we've now completed mini module 5, which is client risk assessment. Please complete the form and the questions. Upon doing so, you can move on to module number 6. Thank you.